excited to have with us two incredible leaders, two friends, two people I admire. Dr. Matias Valenzuela, who's the Equity Director of Seattle King County Public Health, and Dr. Ben Danielson, who's a pediatrician and leader at Seattle Children's or Odessa Brown Children's Clinic. And they're going to be talking with us because we see a lot. We see from King County Public Health that these disparities based on race and ethnicity and geography, they're showing up in a lot of different areas. And our partnership with Public Health has helped us fine-tune our program delivery and our areas of focus. So the data is there, and I can't think of two people who are better positioned to help us understand what the data is telling us and what effect it's having, what is the lived experience in the communities of color. So I'll start with Dr. Matias and ask him to just give us a little bit of an overview, and then I'll switch over to Dr. Ben.
Great, thanks, Gordon, and appreciate. Should you want me to just talk a little bit about what's happening with COVID-19 at this point?
Sure. Yeah. What are some of the big things that you wake up thinking about and go to bed and out in terms of the disproportionality that's been exacerbated by COVID?
Right. I mean, I knew, one of these things is I think we knew even as this was starting and even as we just were having our very first case, because we know how racial inequities play out and we knew what we were going to see around COVID. I think what we have seen has been, and some of the stats were already talked about, it's jaw-dropping. And I also just wonder if sometimes if it was happening at this level among the white community, the kind of reaction we would have as a whole, and it just shows how much we actually still need to do. If you think about, for example, when you compare it to the groups that have the lowest rates, in terms of the Pacific Islander community, it's 6 times higher. Among the Latinx community, it's 5 times higher. Among the Black community, it's almost 3 times higher. Native community, Indigenous community, it's about 2 times higher. So we have, the numbers are quite, discouraging. And also similarly, we see things around hospitalizations and deaths play out the same way. And these are really driven by the same things. I'm glad you mentioned the social determinants of health. And really, this is why we know who has good paying jobs, who lives in the healthy neighborhoods, who has quality education. These structural systemic issues are really key. And then you add on to that some of the things that make, I think, COVID particularly challenging is there things such as living conditions and working situations. For example, communities of color, Latinx, for example, Pacific Islanders, others are more likely to live in multi-generational households. So what you have there is people being infected in community, coming home, and then infecting loved ones. Or sometimes you have multiple families living under one roof and they're infecting other folks there. So that's extremely challenging. And then you have situations where a disproportionate number of, for example, essential workers. So really, and more low paid positions. So you have, in these situations, you have folks who are going to do service economy jobs, working in restaurants. Even in King County, we've lost bus drivers, for example, who are doing their work and are getting infected and then having the consequences of that. So it's extremely challenging. And then there's some things that make for some populations even more for undocumented populations, for example, right now we have, they don't qualify for the federal stimulus checks that most people are getting. They don't qualify for unemployment. So they're actually literally making the decision between, going out and getting some money to be able to feed their families or staying home and protecting their health, at least from COVID-19. So there's this extremely challenging situations that a lot of communities are facing. And it's not only, it's COVID, and then it's all I think the social, economic, mental health impacts that are happening too. So it's compounded.
Right. We're going to go deeper on that. But first, Dr. Ben, you are at Odessa Brown, right in the heart of a traditionally Black African-American community. And you have lots of families of color who are coming to seek medical services. Can you give us just a little overview of what you're seeing in this time of COVID, and to what extent do you see racism and poverty at a high level affecting the families you and your team are trying to serve?
Well, I also just want to say thank you for the invitation to be part of this conversation tonight. Wow, people I really admire, and a chance to spend some time speaking with you. That's a kind of a great evening for me. Thinking about all the ways in which Matias really described the context and the situation that so many families face, and then I was just thinking today about some of the families I've been seeing in the last few days and the way they're thinking about their lives right now, how much more existential the types of decisions that they're making. The amount of trust it takes to ask a family to actually leave their home and come even to this clinic really heightens my sense of responsibility for making sure every bit of the care we provide is safe and is really meeting their needs. And on that second point, it's really driven us to change our model of care in ways that are not exactly new. We've been doing them, but to deepen them in ways I think are really parallel to what United Way is doing. And we're doing so much more just handing out food and making sure that we give out food when people come to visits here and when they're out in the community. We are so much more trying to take care of some of the basic needs in order to help lower that stress level from 100 to at least 99. But I think in the midst of that, there's also this really strong feeling for so many families that this is being done to them in a way that is not happening for other parts of our community. That there is, it is not true or valid to say that somehow this virus is a non-discriminating offender. It is as if this virus was woven into the very fabric of what our society is made of, and then it pulls out every element that is our society's greatest weakness, and really asks of you the use of every part of your strength in our society. And that yellow highlighter pen on issues of racism and marginalization and economic alienation from opportunity is amplified in such a way that it is just a brightly lit light on every bit that I think some of us in society try to either deny or hide from or pretend is no longer there.
Very troubling, very sobering. And I want to explore that a little bit more, Ben. Want to go back to a point that Matias made. And Matias, you talked about a rise of disproportionality and challenge for Black, Indigenous, people of color, in particular Latinx and Pacific Islander. So maybe you can explore a little bit more. And are we taking what concrete steps can we be taking to contain COVID-19 in a way that decreases that disproportionality and that pressure on our BIPOC, our Black, Indigenous, people of color communities?
Yeah, well, I think thanks, Gordon. I think some of the things I know the work that United Way, for example, has been doing around housing and rental assistance. I mean, that's something that in King County we're trying to support as well, because those are other things that are the impacts on the mental health impacts and other things. I mean, I think there are things that we do, and I think within our organization, and then things that I think we would try to support within communities. So within our organization, there are key things that we're doing, such as contact tracing, right? So we are trying to make sure that we're hiring from community that we have. So we have disproportionate numbers of people from the Pacific Islander community. So we need people who are from community, who know those networks. This is not something that you can do from a phone center in another country. You have to actually know it, and it's most effective when it's done by local people who know the neighborhoods, who know the people, who know the stores, who know those kinds of things. So I think doing that internally, and that's work that we continue to do, is how to actually improve as an organization to better reflect the community at all levels. So we continue to do that. I think things like the housing moratorium or things around food security. I mean, there's some really acute issues right now. And then also it's around supporting community organizations that are doing amazing work. And I think how do you really focus on those organizations that are closest linked to community, and begin to think about not just like in big picture, I have talked about Pacific Islander community, but like, for example, we have community navigators that are working on 5 different languages. And that's a new program that we've done with COVID, because we have very specific, whether you're talking about the Marshallese community or the Chamorro community. Marshallese, you have, the history of the atomic bomb and colonization and the distrust. So you can't have, a white dominant system trying to say, hey, you should be trusting our system that we're going to be able to support you in what you need. You actually need to be able to hire and work with those communities. So, how do you work with, in this example, the Marshallese Women's Association, which is a very small group, but very trusted. And it's the only way that we're able to do that work, and that those folks are going to be able to get the support that they need. So how do you actually get in the very weeds of this work and support those smaller groups that are actually doing amazing work right now and have huge resiliency?
Yeah, right. Thank you, Matias. Ben, you operate a clinic that exists in a certain neighborhood, and tell us a little bit of some of the changes you're seeing. Now that we're well into COVID, are there some populations that are not coming in to seek medical services as they were before COVID, or when they do show up, are you discerning a difference? You mentioned stress levels are very high. Can you elaborate a little bit more on what you're seeing?
Sure. As you know, the neighborhood around us, and especially in the last 15 years, has changed a lot. Our clinic serves 80% of the families who come through our door are on Medicaid, and yet the neighborhood is probably the reverse of that, 15% low income compared to the way it was 15 years ago. Many of our families travel far to get to our clinic, and they make that extra trip because historically they've trusted us as a clinic in name, part of the history of the Black community here, and staffed with people who look like the kids who come through the door. And I say all that to mean that I think every layer of possible trust and relationship and connection to community is present in so many ways. And there is still great fear around some of the things that sometimes are being suggested. The idea of testing is not something that is wholly embraced by a lot of families. There's some combination of, I really just don't want to know, or this is just one more thing happening to my family, or I'm going to be stigmatized because of this positive test, and someone else is going to know about it. It's going to affect my chance to be a provider for my family. It's going to mean I'm bringing home a risk to my family. So testing, and I anticipate the conversation around a COVID vaccine, they're going to be more complicated in communities like the one I serve, in communities like the Spanish-speaking Hispanic, Latino, Latinx communities, and possibly in other communities like the Marshallese community that's so heavily impacted as well. There's not a straight transaction about get the information, apply the information, do the thing, and then be protected. It's really much more nuanced, because this reaches down into the soul of our sense of trust in each other right now. And there are way too many messages out there that are undermining, as there are messages out there that are supportive and positive and truly informing.
I see. And maybe that's part of my next question to Matias is, recently King County Public Health declared racism as a public health crisis. And for some of us, that was nodding of the head and appreciation. For others, it was a form of what's this all about? So with this audience here, can you give us a little bit of context on how it is and why King County Public Health has declared racism as a public health crisis?
Yeah, thanks, Gordon. And and it was public health, and also King County Executive Dow Constantine declared it too. Awesome. So it's really county wide, and I think it's really important to give credit where credit is due, which is community. I mean, community has been pushing us in so many different ways. And for example, around the Children and Family Justice Center, which is the youth jail, they've been asking for that to be actually not the new one, not built or be repurposed. And this is one of the things that now Dow Constantine actually declared that we were going to repurpose the detention section of that by the end of 2025. And also, there's been huge gains that we've been able to do in terms of adult detention, just because of from a COVID perspective. Reducing the number of inmates for adults too by hundreds. And then this is a really transformational moment. So how do we actually use the moment right now to push the things that COVID has forced us to do, but then actually then use, our history of racism and needing to address it head on to actually make the changes that we need and continue to do. So for us, it's become very clear that, we are dealing with two crises. It's COVID-19 and racism, and one of them has been with us for a very long time. And I think it's for our white leaders, who are the two that declared, it's really for them acknowledging, how we've been complicit with some of the systems that have been created, right? And then I think the really hard questions are to think about how, and it's no small statement, because, and I want to, we're holding each other to the feet to the fire, is can we actually put the same level of vigor, resources, attention to racism as we have to COVID-19? And, King County has literally engineered itself to respond to this current crisis. And we need that kind of level. I mean, even the Major Disease Organization of America for infectious disease doctors talk about how racism is a greater killer overall than infectious diseases. So if this is an issue that if we're worried about well-being and health and the health of everybody, even the folks that are better off, this is the issue that we need to be addressing. So I think it's the right thing, and hopefully this is something that also continues to build and doesn't go away. But I think maximizing this opportunity right now is extremely important. And listening to community. I mean, at the end, Black-led organizations have been really clear, and that's what we're prioritizing now in terms of our budget and other things. How can we best actually re-engineer, divest, and reinvest?
Yeah, excellent. Dr. Ben, I think you may not be, your video may not be turned on, and if you're able to do that, the audience would love to see your presence in addition to feeling your presence. And I'm going to ask you this next question. Breaking the cycle of poverty, supporting the reduction of people living on low incomes has long been a priority of United Way. And now we have COVID, and I think we're 6 months into it. It has health impacts, as we've talked about. It certainly has economic impacts on a wide sector, a large portion of all communities. But I'm thinking about longer term health implications of the disease on low income families. And do you have thoughts around that, whether it is health or economic or a combination? How is this going to affect our low income families on a long term basis and their health?
Oh, incredibly. I mean, the health conversation, I think, is an evolving one that we keep learning from. There are always new studies coming out that Matias could probably quote much better than I, but very concerning things about the number of people who leave the very obvious part of a COVID illness with lingering changes in heart function and other conditions that are exacerbated. There's a lot that we are going to continue to learn about those kinds of direct physical ramifications, the illnesses that the highly stressed and very exposed to racism communities have bring with them complications that are going to make every case of COVID that much worse. I've seen a baby with the multi-system inflammatory condition. We've seen everything. We've also seen many of the asymptomatic young people who are still then spending time with their elders. And what we're asking of people in terms of family connectedness in order to stay healthy is something that is especially painfully powerful to communities that have really relied on matriarchy and powerful intergenerational connections in order to thrive. And I would say that describes the Black community very well. There's all of that. I think as a pediatrician, one of my first mentors used to love to have a turn of phrase, and one of the things she often said was that you can't educate an unhealthy child and you can't keep an uneducated child healthy, that those things are so tightly linked and related. and the impact on the educational opportunities for folks that we already know by statistics, by experience, by the stories we hear and the lived experiences we know of, are already disenfranchised from a good education from the beginning, from the racism-informed discipline that happens in preschools all the way through the higher chances of expulsion and things like that. This education system is going to bifurcate even further than it already is. And the opportunities for communities that have already been disenfranchised, that have already been alienated from good education, is going to be a deeply exacerbated thing. I think I mentioned that the impact that we saw just from Hurricane Katrina in Louisiana and its disparate impact on communities of color in terms of the extended amount of time it took for educational attainment to even begin to catch up. It's just a very strong omen of how much we are going to be seeing educational opportunity and therefore wellness compromised for a long time to come from this, unless we get smarter, faster, and more innovative.
Gotcha. I'm going to take a pause. Thank you so much for this conversation, sobering, but rooted in professionalism and experience, and turn it back over to Chris and see what kind of questions we have from the audience, from not the audience, from our guest, but thanking you both for your long association with United Way and the incredible work you do in the community. We're so appreciative. Chris and Lee, back over to you.
Great. Well, thank you so much. I'll jump in with a couple of questions you can see in the chat window. The first one, Jeff asked, what's your current assessment of testing availability and turnaround time in the greater Seattle area, especially in the communities that you serve? And as a follow-on, how good is the contact tracing? Matias, would you like to share your thoughts on that first?
Sure. I mean, there's been, I think testing has been, and generally the pandemic response, I think the lack of a federal leadership has been really challenging, if I can say. I mean, and not having a national plan, right? So at the end, we're all trying to figure out both the testing, both the contact tracing, all those kinds of things. And I think this is where you have to acknowledge where we still have work to do, even though we have this commitment to equity and social justice and racial equity. I think when you actually look at in terms of testing, where people who has tested, we have maps and we have data that shows, and it tends to be more Seattle heavy and North Seattle heavy, and really having in South King County is where we have some real gaps in terms of not being able to have enough testing. So that is a real emphasis that we have in King County right now, to actually be able to expand testing in those parts of the county even more. We've had a strategy to use community health centers because those are in community and geographically located, and but that hasn't been enough. So we're adjusting and trying to push more testing there. In terms of contact tracing, similar. I mean, we've been really trying to be thoughtful in terms of how we hire and work with community, and then also setting up the different layers of support. For example, working now with a system of community health workers to support people who are isolating and quarantining. We, as a county, set up some sites and places where people could actually isolate and quarantine. It's been actually underutilized, and we realize that some people actually don't want to go there and they want to actually stay with their family. So we need to be able to do a better job to be able to support people so they can isolate and quarantine in place.
Great, thank you, Matias. Jeff, Rakes, let me pause and see if you have a follow-up question to that, or if we should move on.
Just a quick follow-up. Seattle, one of the innovations from Seattle is the Seattle Coronavirus Assessment Network, based on University of Washington Brotman Beatty Institute. And I'm wondering, which involves home self-collection kits rather than having to go to healthcare centers. I'm wondering to what extent that serves the communities that you're serving more effectively, or is it not useful or not available in your communities?
It's been used. I mean, we have been promoting that service. We have been helping to make sure that the information is translated, trying to take some information that's actually honestly was quite dense because I looked at it myself and then said, this needs to be made much more accessible. I think being able to test at home is a great mechanism, but actually, I believe even through that, if you look at the numbers, it's not reaching really the targets or the needs that to meet the needs of communities. So we do have, as I was mentioning, we have community navigators who are sharing this in, trusted leaders who are sharing this with their communities. But I think it's not having the level of reach and the scope that is really needed. Also, there were some interruptions with SCAN for a few weeks, I believe, as well, too. But I think it's not just one thing. I mean, even in terms of COVID and transmission, it's a multiple, you need all these different strategies, including continuing a physical distance and all these kinds of things. So you need to have, I think it's an important tool.
Thank you.
Great. I should have mentioned people can type their comments or questions into the chat window. You can also raise your hand. There's a little hand icon at the upper right of your screen to sort of flag my attention. And I'd love to ask Mary Snap if she'd like to unmute and ask her question as she raised her hand.
Thank you, Chris. It's great to see everyone here. Thank you for the great work that you all are doing. My question is to Dr. Ben, and you've been a board member of the United Way. You care so much about these issues on health and disparities with COVID in underserved communities, and particularly the BIPOC communities. I'd like to ask if you would, if you came back to the board or even had Gordon's job or Chris's job, would you invest in a different way, different organizations, or would you ask for programmatic changes in some of the programs and the focuses that United Way has had? And I know this question relates to both something that could happen short term and also related to the issues of race and social justice over the long term. So it's a broad question, but I'd love some guidance from you.
Whew.
Yeah, I
Thank you
know.
for that
I'm sorry.
generous questions. I really appreciate it. It gives me a chance to sort of think broadly. I have to tell you, I smiled when you had me starting to think about my time on the United Way board, because I really, really appreciated that. I grew so much through, largely through the board members that I had a chance to interact with and get to know and hear their wisdom, but also in ways that United Way works. And in some ways, I see us as a clinic and me as part of a community trying to apply some of the lessons I've learned from the United Way board in some of the work we're doing. I heard Matias talk about it too, but the first sentence in our equity statement says that it is the communities most affected by disparities which have the best solutions for improving. And centering communities and those most affected is one of the most important foundational tenets of doing any work that's meaningful around racial equity and addressing issues of social justice. And United Way taught me a lot of lessons about that, about finding entities in communities that are led by communities members that are focused on and have their deepest roots in those communities, are not helicoptering in, and are doing meaningful, proven, trustworthy work. And by proven, I mean proven by the communities themselves, maybe even more than by some statistical analysis that might not take into account some of the really important components that are just individually true to individual communities. That kind of partnership, that kind of catalyzing as opposed to taking over, that kind of really making relationships that United Way has done has been a really inspiring thing to me. And there's just sort of more of a desire to double down on that. A second thing I would say is places like Gordon, you're in a position of such well-earned and important ability to make changes happen right now. And I sleep better at night knowing it's you doing this kind of work there. And I think about some of the other lessons that I've learned from medicine and from communities, and one of them is sort of this thing I call the equity pause, and it relates to what surgeons do now universally to be more careful when they're making life and death decisions, like about to cut into the body of another person and do something invasive. They have now a rule where they have to pause and do a checklist and make sure I'm going to cut into the correct knee, or I have all the things I need with me, or making sure you just kind of take that extra breath and think about something before you make a big decision. Applying that to this situation right now, I've seen situations where other entities and organizations have had to make big decisions fast. Hospitals, state governances, county governances, and the need to make them fast is important, but the need to breathe while you're making them is really important too. So our equity pause invites us to ask 3 questions while we're thinking about something important. One is the community really centered in this? Have we heard from the folks most affected before we're trying to make decisions? The second is, what are we assuming about people in their abilities when we talk about things? With all respect, a stay-at-home order for an essential worker is sort of a slap in the face. A third is, what are the unintended consequences that we really need to be thinking about when we're making these decisions? It's just maybe the pause, or it's maybe the contemplation of those 3 questions, but it's an important way for us not to drift away from our commitment to equity-based decision-making. Then the third piece, I'll just say quickly because you brought my mind into it, is I feel like I've been part of a number of efforts that have been just wonderful and fruitful in their ways across different parts of communities, and I'm just very honored to have been just playing a role in them. I will also say that the majority of the effort and resource over time has gone into helping people who are disenfranchised be less disenfranchised, helping people who are up against many barriers have fewer barriers. And at some points, there's some moments when I wake up at night and I wonder why we are just trying to prepare people to navigate bad systems better, and why we aren't really taking on changing those systems themselves with a little bit more effort and fortitude. I don't know if that makes any sense at all, but sometimes feels like there's a version of blaming the victims when we just try to change them in order to survive what could be bad systems.
No, I really appreciate that. And as you know, with the work on the YWCA and you now joining that board, I think about those topics a lot. I mean, what is just trying to fix outcomes versus doing things earlier on?
Great, thank you. Tricia Rakes asked, given the likely long duration of the presence of the virus in our community, how do you see support shifting to support families who are already highly stressed, to give them access to education this fall for their children, along with these basic needs that we've already discussed? Any thoughts on that? And I'll maybe open that up to Gordon as well, who may have some thoughts on it.
Can
Matias,
I start?
Dr. Ben?
I just want to say, because this is a mirror moment, but I look back to Tricia and Jeff, and they're really lifting up of this idea of what is sometimes called targeted universalism. I really look to the methodology that intentionally creates solutions for those most disenfranchised first and foremost. And what comes from that is beautiful. It is the opportunity for many, many other groups, for all other groups, to benefit from solutions that are based on really looking to how would you design it so that the person most disenfranchised, most oppressed, most marginalized has what they need to thrive. When you do that, you end up making everything better for everybody. And I just think we need to hold that kind of mentality and methodology in our hearts and heads if we're going to get serious, as Matias was saying, about making big changes as opposed to incremental ones.
Yeah, I totally agree. I mean, we try to, Ben, we try to use that and build on those models. And I know with the work you've been doing with Best Starts for Kids and others, I think we have great examples of where that's working. I think it's also around this, and just also building on what you're saying, Ben, is thinking about, because for me, it does make me sometimes uncomfortable. Then we have to start with the data that shows the differences in groups, because I mean, at the end, it's like the deficit model. And when you talk to community, I mean, it's all resiliency that you see. And I think that's extremely important, how we build on that. And I think that what you've been saying, Ben, there in terms of the approach, and really when you do it with community and fund community, and then it's actually solutions that are sustainable and will actually work. And also learning how to get out of the way. I mean, we're often part institutions and others are part of the problem. And we sometimes it's just a, even as a county, give the resources and get out of the way. One of the things that what has me, kind of very concerned right now this week, as it actually changes, is even the developing situation that's happening with schools, for example. And this is just the ongoing challenges that we're having with this. One is, of course, those who, youth of color, also youth with, those with, or children with disabilities and special needs, all those are how hugely impacted they're going to be by this major move to go online. We already didn't play our role as a society by keeping numbers low so we can actually safely open up the schools. But one of the things that's happened here is one of the unintended consequences, or maybe, if we step back, it becomes very clear, is now what this is going to mean actually for childcare and for out of school care, that right now are going to be still, kids are going to be congregating, right? And also the workers of childcare centers and out of school care are disproportionately people of color are going to be impacted in great ways. So, we have such a siloed way of thinking about it, and thinking about, this move in terms of the schools and most of them moving online. That's going to have a huge effect on kids who are most disadvantaged, and then how the other effects is going to have, that's going to continue to exacerbate issues. And just thinking about childcare and the problems going to happen there. It's, we do lack a sense of imagination and be able to think about big picture, right, and across sectors. And we need to be able, times like this, we need to be able to do that.
Thank you. Next, I'd love to ask David Mentz, who's raised his hand, perhaps to unmute and ask his question.
I have a follow-on question to what Ben had described about examining some of the structures. And I think part of my question was answered, but I guess I'm still curious about what either of you may see as examples of those structures, and perhaps some of the less obvious ones that you feel, though, are still important, but maybe overlooked in terms of opportunities for change.
I'm happy to go, Ben. Well, I'll start maybe. And one of the things that we're doing right now as a county is, we've been doing, and we have an ordinance around equity and social justice, and have been doing this work for quite a while. But we had a thing about, when you look at our general fund, which is the funds that are, that we could really control, that they don't have the resources. The way 3/4 of our general fund go to the criminal legal system. Right, the courts, the jail. I mean, it's a very expensive kind of downstream, basically stopping the bleeding and then causing a lot of harm as well to people. So thinking about that, and we are at a point in which we're actually trying to think about, as a county, how do you actually think about that slice of the budget, and thinking about, or very significant, and how do we actually have that support what is true to our values and what we want to do, right? And that's taken us from stepping back, and we had the systemic way of basically every budget cycle was basically taking incremental budgeting, just looking at little changes in the budget and not looking at overall what can we do, and think with some imagination, and really, is this aligning to our values and what we really want to do and how we spend every single cent. And we are doing something, I think, that I never imagined in my years. I always hoped, but I hadn't imagined in my years in King County government, to think about really at a very deep level, how can we make that alignment? It's not going to be in one budget cycle for us. It's going to take many, but we have to, take on those systems that have been created and dismantle some of those things. It's going to be hard for some sectors, especially the criminal legal system, but it's something that we need to do, and it's being asked for by our communities.
Dr. Ben, anything to add to that?
Just again, that, if that feels like the right question for to be asking communities directly and to be hearing what kinds of ideas come from that. And sometimes they begin as very individual, very individualistic, and then you start to see the threads that are common, and you start to see the systems behind those threads, and you see amazing things happen. I was talking to some young people just the other day about just also learning from our history, and I was thinking about the history of housing covenants and redlining, because that's how the central district that I work and live in was started in the first place, and how some of that was dismantled. And I was thinking about how it was youth, young African American people, mostly women, young women, who started doing sit-ins and protests in 1963, and then other activists working, and then there was legislation passed in 1968 that created open housing laws. And then in 1975, it was included to add prohibitions against discriminations based on sex and marital status and sexual orientation and political ideology. And then in 1979, it was added on to include ageism, age discrimination, and parental status discrimination. And then in 1986, it was creed and disability that were added on as prohibitions against discrimination. And then in 1999, it was gender identity that was added. And there's the idea of building on movements based on what you hear and listen for in the voice of communities, and seeing I guess that is like targeted universalism. That is an idea welling up and then making differences in systems that allow so many people to benefit. And yes, a long ways to go on that journey. However, the history that's there makes it impossible for us to stop on that journey towards making sure that housing access and eviction laws and things like that are really supportive of broadly based communities and diversity. I know that was a tale going off to the left-hand side, but I think it just illuminates in some ways the way things can work if we really get organized around them.
Yeah.
Thank you. Thank you for sharing that. I think the last question we'll take before moving on to the sort of final portion of the agenda, I'm going to ask the question that Jeff Bradley typed in. He asks, it seems that we have a rapid increase in infection rates when we reduce policy constraints and move to a next phase. What's missing in our policy and in our approach to not backslide when we move to a next phase? Or is this just unavoidable outcomes? Any thoughts on that, Matias or Dr. Ben?
I mean, part of the biggest numbers in the last month we've seen, especially on young people, 20 to 40 years of age, right around COVID. And it's also more heavily, a lot of more white population. You probably saw in Greek Row, and some of the images in Florida of spring break and those kinds of things. I mean, I think, and I love the messages around wearing a mask. That is, it's a signal of love. I mean, love to your, to your neighbor, to your family, to other people, that you actually care for folks. And I think really also the most important things that we could do is continue to be, like, from the public health perspective, the physical distancing, wearing a mask, those very, the contact tracing and testing, those are tools for when already you get infection. But those other acts are extremely important, right? And, and those have to be done thinking, with a lot of empathy and compassion, because you might not necessarily be the one that, is the one that is at risk, in that high risk category. But I just, and I'm not from this country, so I sometimes, originally I've been here for a very long time now, but I just think about this individual versus more communal approach to things. And, if we did have a more different way of thinking about this disease and each other and how we behaved, we'd actually be in a very different situation right now. And I think we would be opening up all our schools, and kids would be able to go to other, and learn. I mean, this is having humongous impacts on our society for a very long time. I mean, this is going to be a lifetime of effects for many, many, many kids. And I think the United Way and the way the work that's being done here has that different framework. I think it's where it's at, and it's around, compassion, empathy, love. That at the end, those things, it's hard to communicate those things, but it makes a huge difference, right? In terms of something like a COVID and how it plays out and how people act and behave.
That's beautiful. I would just add, we have a really good opportunity to be learning really quickly right now. And if I were toasting all of you and sitting with you right now, I'd be thinking in my head also about how we have both overestimated and underestimated our communities, in my view, around our public health messaging for this pandemic. And I think we need to examine those places where maybe that 3 week, just 3 weeks kind of promise at the beginning of the March when schools were sort of suspended, whether that was helpful or harmful, whether that was an underestimation of people's ability to adjust, whether we've overestimated how long people can be hitting particular messages over and over again without actually either going deeper into the deepest meaning behind those messages, like you're saying, Matias, or engaging and encountering and having dialogue instead of messaging, and really creating opportunities for dialogue between trusted people and relationship building kind of settings would be the better way for us to be moving forward and creating sustainable changes in the way we do things in order to make sure we as a society have a chance to get better. What do we have to learn? Where do we overestimate and where did we underestimate what our fellow humans are capable of?
That really resonates with me. Thank you. Thank you to you both for being here.